Warahmatullahi wabarakatuh. Sabah al-khair jami'an. I am Hatim Rashid. I'm very happy today to present our project. Our project title is about appropriateness of antifungal therapy in patients with Candida bloodstream infection. It is a single center retrospective study in critically ill patients. It is reported at literature that above 80% of fungemia cases are caused by Candida species, which is frequently encountered in patients who is critically ill and immunosuppressed. The diagnosis of candidemia is challenging due to low microbiological yields, and culture may take up to 5 days. 5 days is a long time. Candidemia is also associated with high mortality and morbidity. It says, however, the appropriate antifungal therapy can reduce the mortality by 50%. So today we are talking about 50% mortality reduction if we use the right appropriate antifungal therapy. But what is appropriate antifungal therapy? Based on previous definitions of antimicrobial therapy, appropriate antimicrobial therapy, in this study we have defined appropriate antifungal therapy as it is early treatment within 24 hours of sepsis recognition and appropriate selection before culture results and based on Candida scores. Let us raise another question. What is Candida score? A Candida score is a known tool that we use to predict patients' ability to develop candidemia. We have used the Candida score for all our population. We have collected for them. Up to our knowledge, not that's fungal therapy. But what is appropriate antifungal therapy? Based on previous definitions of antimicrobial therapy, appropriate antimicrobial therapy, in this study we have defined appropriate antifungal therapy as it is early treatment within 24 hours. Up to our knowledge, very few studies that have been published addressing the appropriateness. How appropriate is the empirical antifungal therapy in treating patients with candidemia? Let's get into the methodology. For our objectives, we have primary and secondary objectives. For our primary objectives, we have two main primary objectives. We want to evaluate the appropriateness of antifungal therapy in patients with candidemia. Also, we want to assess the mortality and length stay in those who got appropriate antifungal therapy versus those who did not get appropriate antifungal therapy. Characteristics and their outcome. For design, it is a retrospective, observational, and analytical study between May 2019 till June 2022. We have included all appropriateness or the practice of appropriate antifungal therapy in patients. So, our study research, our research question: how appropriate is the empirical antifungal therapy in treating patients with candidemia? Let's get into the methodology. For our objectives, we have primary and secondary objectives. For our primary objectives, we have two main primary objectives. We want to evaluate the appropriateness of antifungal therapy in patients with candidemia. Also, we want to assess the mortality and length stay in those who got appropriate antifungal therapy versus those who did not get appropriate antifungal therapy. And for secondary objective, we want to describe patients or population characteristics and their outcomes. For design, it is a retrospective, observational, and analytical study between May 2019 till June 2022. We have included all the patients who was diagnosed or had blood culture with candidemia. We have excluded patients, that's a huge percent. And the mortality and length stay cannot be assessed, cannot be calculated due to large confounders we had in our population. As we observed, the majority of our population had high SOFA and Apache. So they are getting our population, they already has a high rate of mortality. Majority of Candida isolate was 78, non-Candida albicans. As I said, it is multi-drug resistant. Record missing, and patients who are still hospitalized because their outcome cannot be assessed yet. For our population, we have collected 591 blood culture that is positive from microbiology lab. We have excluded them, filtered them, and excluded 315, and excluded 2 more patients because they were hospitalized, and we ended up with 276 patients enrolled in our study. A huge percent. And the mortality and length stay cannot be assessed, cannot be calculated due to large confounders we had. So they are getting our population, they already has a high rate of mortality. Majority of Candida isolate was 78 we want to publish, of course, and we want to do it multi-centric study, and the result need to be used to optimize the practice of appropriate antifungal therapy in our patients. This is our references which we use, and thank you all so much for your listening.